Welcome to the Dreamers
Welcome
Podcast,
to Dreamers.
where we give the stories of individuals who dare to dream big, break barriers, and redefine what's possible. My name is Asfan Musa.
And I am Munir Rahman. And today we're honored to have a great guest with us whose journey is nothing but extraordinary.
That's right. So let me go ahead and introduce you to our first guest, Dr. Thomas Glenn. And I have a little introduction for you, so I'm going to go ahead and say that. So Dr. Thomas Glenn is a pediatric cardiologist at Texas Children's Hospital, specializing in congenital heart disease, particularly single ventricle physiology. He is deeply involved in groundbreaking research, patient advocacy, and medical education. He's been part of major cardiology networks, published research in top medical journals, and is a leader in improving long-term outcomes for congenital heart disease patients.
Again, his journey is becoming a doctor is truly inspiring for, I think, most of us. Unlike most U.S. physicians, he attended medical school in the Caribbean and once was a cardiac patient himself. Both with hypoplastic left heart syndrome, he turned his own health obstacles into a life mission and proving that no obstacle is too great to overcome.
Yeah, so what has shaped you in becoming the physician you are, basically?
Very cool. Thanks so much for having me, and I'm honored to be you guys' first
Thank
guest
you.
on the podcast. So I feel like the bar has been set pretty low for me, which is good since we're starting, but I'm looking forward to having a good time with you guys today.
Let's talk about your story first. You were once a cardiac patient before becoming a doctor, correct?
Yeah.
Perfect. You were born with hypoplastic left heart syndrome, HLHS, which is a serious condition, especially at the age you were diagnosed. And you underwent 3 open heart surgeries.
Yeah.
Can you tell us what it was like growing up with it, the whole process, when you got diagnosed with the HLHS?
Yeah, absolutely. So, truthfully, I don't remember much of it because I was diagnosed a few hours after I was born, and this was not something that my family knew of before I was born. I was born in 1990, and back in the early 90s or the mid to late 80s, these were diagnoses that a lot of patients didn't survive with. And really up until the mid 80s to late 80s, these surgeries to repair specifically, serious single ventricle heart disease like hypoplastic left heart syndrome, there was really no options for those patients. So before the mid 80s, when these surgeries were kind of developed, these patients essentially they didn't survive, and oftentimes the families would take them home or they would have to get a heart transplant. But in 1990, when I was born, we discovered this a few hours after I was born. I was transferred to another hospital, and just so happened that the hospital I was transferred to, there was a surgeon who had actually just learned this surgery called the Norwood procedure. And he had just trained with Dr. Norwood himself on the East Coast. And I was just happened to be born at a time when he felt comfortable enough offering that option to my parents and my family.
Yeah.
Truthfully, they actually, at that time, he had never had a survivor because he had just learned about the procedure.
Mm-hmm.
And, he had done it on a few patients, but none of them had left the hospital. So they actually recommended to my family that they don't do the surgery and just, let nature take its course and take me home. But, thankfully, I had some parents that didn't allow that to happen, obviously. And they pushed further and pushed the medical system and were able to get them to do the surgery. Obviously it worked out. And, with that, with my congenital heart disease, there was a series of other surgeries that had to happen to get me to a point. And I completed that series of surgeries around the age of 4. And I've been doing well ever since. And I've been very lucky to have a really good medical team around me. And I think I've done well considering the circumstances and the timing I was born. So I've been very blessed with that.
That's wonderful. And there was an article that I was reading which said something about the physician who was taking care of you. She really motivated you because she talked to you more than as like a person. It made you see a purpose in talking to her. And it wasn't just like, what's your disease? What's going on? What are the symptoms? So it showed you like a different way of taking care of your patients, correct?
Yeah, that's true. I think one of the reasons I went into medicine was because I had such a good cardiologist growing up that were taking care of me. And, rather than just treating me like a diagnosis or talking about the results of the test, they really pushed me to be everything I could be. And, despite everything I was going through at, different parts of my life, they, told me that it doesn't matter, that I can still accomplish whatever I wanted. And they really motivated me to go into medicine, as that was something I'd expressed interest in. When I first expressed interest in that, I know my mom freaked out. My dad was cool with that, but my mom was like very worried about the stress and the caffeine and having to stay up all night and thankfully my cardiologists were there, especially this one cardiologist I wrote about, who is now retired. Her name is Dr. Vincent. But she was a cardiologist that really pushed me to do whatever I wanted and accomplish my dreams. And I really, would be remiss in saying that I did not become a cardiologist if it wasn't for her. And I think I went into pediatric cardiology specifically because I knew I wanted to have that same impact that she had on me with some of my patients. And I hope, in my very young career that I've been able to do that and will continue to be able to do that for my patients.
That's beautiful. And from my experience of shadowing you, I can tell like your patients love you. Yeah. So
that's
you've been doing
you.
an amazing job. Thank you, doctor.
Thank you.
And yeah, that was my next question. How did being a patient motivate you to becoming a doctor? So I believe you answered that. And another question was,
I mean, I got one.
Go
So I don't know if you like talk about certain cases, but do you have like a certain case in mind that you've helped that like really motivated you or kind of saw you like a full circle moment, you would say?
Yeah, that's the thing. There wasn't really a specific case that really made me, one, interested in medicine or in the field I chose, pediatric cardiology. I think it was really my experiences at a young age that really told me that this is what I was meant to do. I think there's a reason that my parents chose the path for me that they chose, and there's a reason that I happened to be at that one hospital that had the surgeon that had just learned the surgery, and I think that's really what got me into this medicine and pediatric cardiology. I will, be honest and say that I did force myself to like keep my mind open along the way, and I think it's easy to just be focused on one field and people that are going into medicine or thinking about going into medicine. I think that's one thing I would tell them is keep your mind open. I did keep my mind open and I tried to be interested in other things, but no matter how hard I tried to like look into other things, it always came back to pediatric cardiology, no matter how much I tried to be interested in something else. So I really do think this was just my fate. Basically.
It's like meant to be kind of thing,
Exactly.
Yeah. And would you like to tell the viewers what exactly is HLHS, like a little bit about it?
Yeah, so HLHS, or hypoplastic left heart syndrome, is basically a form of congenital heart disease, and congenital heart disease means it's a heart problem or a heart abnormality that you're born with. And it's CHD, or congenital heart disease, is the most common birth defect, and we see that in 1 in every 100 babies that are born. HLHS is a much more serious form of congenital heart disease in that the whole left side of the heart is underdeveloped. So the left ventricle, the main pumping chamber of the heart, is often very small or kind of rudimentary, we say, meaning it's not really helping at all. So you really rely on the right side of the heart to do all the work. With the left side being underdeveloped, the aorta, which is the main artery that sends blood to the body, is also underdeveloped. And if you can imagine, without almost half of your heart being developed, you have to really do a lot of plumbing and kind of move things around and do a lot of things to get to a point where you have a functioning heart that can supply the body, the lungs, and everything you need for several decades. So that's why there's like a series of 3 scheduled kind of palliations or surgeries to get you to a point where you can go off and do what you want.
Okay.
We can go to the
next segment.
Yeah.
All right. Now, I want to ask you about the journey that makes like your journey unique, as the fact that you did not go to medical school in the U.S. and you took a different route in the Caribbean. And I kind of want to talk about that. Can you tell us about your experience of like applying and even going to school over there, how that was?
Yeah, so I'll start off by saying going into med school in the Caribbean was not my original plan. It was the plan I ended up taking, but it was not what I originally intended to do. When I took the MCAT, I just really didn't do very well. I did well in the science sections, but the reading comprehension, I always struggled with that section, and I did so poorly that I was, I applied to several U.S. med schools, and I spent a lot of money doing that, but I did not get any real interviews or any opportunities to stay in the U.S. for med school. So I was a senior in college, and I was getting denied from all these med schools, and I'm like, it came close to graduation. It was, probably close to like winter break at that point, and I'm like, I don't have very many options left. I'll see these few that are left out, but they didn't pan out to anything. And I, was like, all right, I have a couple different options. I can do a gap year, which a lot of people do, and I think that's a normal thing for people to do nowadays that either need time before they're ready to apply to med school or need to take more classes or retake the MCAT or something. So that was an option, but I didn't have a job at the time, and I needed to fund myself to live on my own. And for me, that wasn't the option I wanted to take. I could have gone and done like a master's program, which I really considered. But again, I was just delaying the inevitable. I felt like my scores were still going to be what they were. And I wasn't sure at the time that a master's in some research program would have really made me that much more competitive as an applicant. And then the other option, but other than Caribbean, was to go the DO route, which I also considered. And looking back now, I think I made the right decision, but I think that there's anybody in that same situation could have gone different routes and probably would still end up at the same place. But ultimately, I chose to go to St. George's University, which is in Grenada. It's a small country, about 90 miles off the coast of Venezuela, so pretty close to South America. And they gave me the opportunity to go in and, with the Caribbean schools, most of them, you will do 2 years of your basic sciences. So your first 2 years of in the classroom kind of work, and then you typically come back to the United States to do your clinical work, which is really I would say the most important of your medical school training, because that's really where you're getting the hands-on experience. So I did my 2 years in Grenada. I did really well. I exceeded, what I was kind of probably expected to do, and I was able to come back to the U.S. and do my clinicals. Most of them were in the New York area, Brooklyn, Manhattan, but various hospitals. And I think it gave me the opportunity to do what I wanted. Could I have gone one of those other routes and done the same thing? Absolutely. But I didn't feel like delaying another year or 2 years or 3 years. For me at the time was the right move. And that's ultimately why I chose that route.
Yeah, honestly, I think that's like a big thing too. Is people delay, take gap years, and then they'll apply next cycle. So like the fact that you didn't want to wait, you just kind of want to go straight into it is a big thing too. Like most people don't look at it that way. They want to apply in the Caribbean schools.
And at that time, I had also retaken the MCAT, and my reading score did not change at all. So at that point, I had 2 MCAT scores that were very suboptimal. And I'm like, there's nothing that's going to change this kind of red flag on my application.
Yeah.
So I just was like, I'm just going to go do this. And, there's definitely a risk associated with it. I think if I was interested, at that point, I knew I wanted to go into pediatrics or some pediatric subspecialty, which certainly, from a matching standpoint is much easier than a dermatology or a surgery or, many other specialties. So I think knowing that I wanted to go into a primary care kind of field like pediatrics helped me feel more comfortable with that decision. But I think if I wanted something more competitive, I would have really thought more about it and maybe taken that gap year or stayed in the U.S. and done something else.
And I kind of know, like you already talked about this, but like you have a message for like future med students that like are really like disheartened to go to Caribbeans, because I feel like the medical field, a lot of, I guess even in our student org AMSA, it was very like looked down upon.
Yeah. It's like a stigma about the Caribbean medical school where if you don't get it accepted in a medical school, U.S. medical school, they look down upon it a lot, where they make it look like, oh, you made probably the worst possible decision out there. Yeah. So would you like to say something about that?
Yeah, I mean, I think ultimately everybody has a different path, but I think that all of those paths in many cases will lead to the same end goal. I think, if you look at where I've been since the Caribbean, I did my residency at Rutgers, which is an academic institution. I did my fellowship at University of California, San Diego. I then went to University of Michigan for my extra fellowship, my 4th year fellowship. And now I'm at Texas Children's Hospital, Baylor College of Medicine, which is ranked as one of the best pediatric cardiac centers in the world. So I think there is a stigma associated with it. I'm not going to lie about that. And I think even when I was looking into it, I was a little embarrassed to tell people that was the route I was going, because they're like, well, you had good grades. Why don't you just stay in the U.S.? And it wasn't that easy, obviously. But I would say to people, the further you get from your medical school, the less people are going to care about where you went to your med school. I think what I made sure to do, in addition to getting good grades, was really exceeding on my the board exams, basically, and making sure that I did well in the step 1, step 2, because especially step 1, because that was really the big thing, the big hurdle that they told us when you went to a Caribbean school, that you needed to do really well at step 1 to be, almost have a higher score than everyone coming from the U.S. to show that you do belong. And honestly, all the professors that we had in the Caribbean, they're all U.S. professors.
Yeah.
They were all, American taught professors that come down for a couple of weeks, teach their sections, and then they leave. So I'm getting taught by the same people that are teaching at these other great med schools.
Yeah.
Yes, my hospital experience for the first 2 years, which is pretty minimal at most places anyways, was different. But my 3rd and 4th year, I was at the same places that a lot of U.S. trainees were at anyway. So there is a stigma associated with it. I agree. I do think that as medical training changes and board exams are more pass-fail, and maybe grades are like not numbers and they're more pass-fail, I do think that makes it harder for Caribbean grads to stand out, because the board exams were a way that we could stand out. So that is one thing that I think people that are looking into that as an option should really consider. It's becoming more difficult to stand out as a Caribbean grad without like an actual number that you do your board exam for.
But like you said, as you move further in your career, like it kind of doesn't really matter.
Honestly, people are mostly looking at the last place you've been or maybe the last two places you've been. And at this point, I couldn't tell you a single person when I was applying for my first job where I'm at right now who asked about my medical school training, where I was, why I went there. There were questions when I was applying for residency because that was the last thing I had done. But now that I'm 3 steps past that, no one's asked and no one has cared. They care more about the last 1 or 2 things you've done.
Yeah, and despite all of that, I'm going to move on to the next
Yeah, we can move to the next one.
Despite the untraditional path you took, I mean, like you said, you're at Texas Children's Hospital, which is one of the top pediatric cardiology programs in the country. Can you tell us about your role and the research you're currently involved in? I know we talked briefly on the text where you were trying to start your own research at Texas Children's as well, but I know you've done some research in the past other than Texas Children's Hospital. So could you tell us about that and the role that you're at Texas Children's Hospital?
Yeah. So for the listeners, I'll explain. I'm a pediatric cardiologist, which means I take care of infants, children, young adults who have congenital heart disease, or pediatric patients who have cardiac complaints. So my primary role is I'm a general pediatric cardiologist. So, I do a lot of time in the outpatient clinic. So I see patients outside the hospital who have cardiac complaints. So regular kids or teenagers who have chest pains, they've passed out, things like that. They have a murmur. But I also see patients who have congenital heart disease and were either diagnosed prenatally or after they were born, and either have had surgery or have not had surgery yet. And I see them and manage them before they need surgery, or if we're just watching how they're doing and maybe don't need surgery. So that's most of what I do on a weekly basis. I also spend time on the inpatient side of pediatric cardiology. So I do anywhere between 10 and 12 weeks of inpatient service, meaning I'm taking care of the patients in the hospital who either are there because they had surgery or they're awaiting surgery or they have other issues going on. And those patients typically do have different forms of congenital heart disease. And I'm basically taking care of them in our step-down unit. So after they've kind of de-escalated from the ICU, they're getting ready or closer to going home, and we're kind of tying up all the loose ends, making sure they're ready to be discharged, eating and drinking okay, on medications that they can take by mouth, things like that. I also have a very vested interest in the single ventricle population, like myself. So we have a single ventricle clinic specifically for really our young patients who have single ventricle heart disease. So I see patients there once a month about. I also see patients in our Fontan clinic, which is kind of after the last surgery that our patients with single ventricle heart disease, they have a Fontan is what it's called. And those patients come into our specialized clinic where they can see all the different providers, like a liver doctor, they see a cardiologist, they can get exercise testing, they can see a psychologist for all their different needs. So I see patients in that clinic as well. And then I also have an interest in exercise in the congenital heart disease patient, and I help staff our exercise lab. From a research standpoint, you can kind of guess that's where all my research interests are. So I have important interest in kind of long-term outcomes of patients who have single ventricle heart disease. Like I mentioned to you, these surgeries really didn't come out until in many cases the 80s or 90s, and a lot of patients now are the oldest patients are for the most part in like their 40s, 50s. So looking at long-term outcomes, because we don't really have those, and seeing what factors might impact that is an area I'm interested in. The mental health piece, there's a lot of new research that shows that the mental health components for these patients, we know that they have anxiety, depression, PTSD, a slew of different issues, and how can we support them through that journey? Because it's not normal as a child to go to the hospital often and have open heart surgery 3 times. It's not normal to have to take medication. So for our patients, focusing on their mental health is an important thing, and I have a lot of interest in that. And then the exercise piece. A lot of our patients with congenital heart disease 20, 30 years ago, we told them to not exercise because we were scared about what might happen with their repaired heart. But now there's a lot of good research that shows that exercise is actually really, really important in their long-term outcomes. So I have interest in that as well, and that's some of the work we're doing.
And one of the research papers that your name was on, you're part of a Fontaine Outcomes Network, where the whole the purpose of the network is to help the kids transition from childhood to adulthood. Yeah. Would you like talking about that a little?
Yeah. So there's this model that's called Learning Health Networks, and basically it's a group of scientists, researchers, clinicians, so doctors, nurses, nurse practitioners, and then also patients and parents who all come together, and they basically do research projects, QI or quality improvement projects to try to improve the long-term outcomes for patients. And they have these in various disease processes. So they have a nephrology or a kidney one. They have an inflammatory bowel disease one, but they also have one for single ventricle patients. So there's the NPC-QIC, which focuses on the kids in the first year of life. And then there's the Fontaine Outcomes Network, which is the one I've been very involved with, which focuses on patients after they have their Fontaine procedure, which is usually around the age of 4 to 5, and then follows them through the lifespan. Incidentally, those two networks are actually combining to SV1, which is the Single Ventricle Outcomes Network. But with that, I'm on the executive leadership team, and really we're trying to focus on these patients both from the time they're diagnosed fetally through the entire lifespan, well until, fourth, fifth, sixth decade of life, and focusing on how we can improve their outcomes. Because on an institution or a single hospital level, there's not that many patients with each of these diagnoses to study and research and follow because it's so rare. But when we come together and we have 30, 40, 50, 60 places across the country or the world that are all tracking the same thing, we can get big data and really track these patients a lot closer. And that's what I've been involved with, and looking forward to being involved with them for many years.
That's great to hear, honestly. Great program you have going on.
Yeah. Thank you.
Another question I had. So back when I was shadowing you at Texas Children's Hospital, I read about the Glenn procedure. Is that something related to your name?
So the second stage procedure or palliation for most patients with single ventricle heart disease is the Glenn, but there's absolutely no relation with me. No, nothing at all. It's just a weird coincidence that I both am a pediatric cardiologist. I happen to have a Glenn, and there is,
because one of the medical students who were working with you, he actually joked about it, maybe to me, and he was asking me, do you not know about this? It's his procedure. Yeah, he invented it. I was like, oh.
The funny thing is that a lot of parents, that I see have their kids have a Glenn, and they often will say things like, oh, that's funny, the Glenn and your name, and you're in pediatric cardiology. I'm like, yeah, but you don't know the other part of it. I also have a Glenn. So I think it really is full circle, but there is absolutely just no relation at all.
Okay, wonderful.
All right, next segment.
Yeah.
All right, so I know, just hearing from you talk, you're very passionate about your patients and how they're developing in the future as well. What's some advice you'll give to future physicians on how to provide the best care for their patients?
Yeah, that's a really great question. I've learned this. I've only been practicing outside of my fellowship for the last 1.5, almost 2 years. So a lot of what I'm going to tell you is stuff I learned from my own cardiologist. And what I try to instill in my patients is, it's really easy to go into the room. You have, 15, 20, 30, maybe 30 minutes to interact with the family and the patient. I think for patients, providers who are pediatricians, I think especially when they're of age, focusing on the patient is really, really important. It's really easy to walk in and talk to the parent and not really interact with the patient, but you should, even if they're 7 or 8 years old, you should be asking the patient, how do you feel when you're doing this? What are your interests? I think focusing on the patient as opposed to just talking about the lab results or the echo results, because honestly, a lot of that stuff isn't changing on a moment-to-moment basis or a visit-to-visit basis. So I think focusing on their mental health, if they're exercising, what are their interests, what do they want to accomplish in their life? I would encourage all up-and-coming physicians or med students to really try to focus on the patient and get a whole body idea of the patient, because that's what they're going to remember. They're going to remember those conversations about, oh, that cardiologist told me that I should be exercising and doing this, or they told me that I can accomplish my dreams. But they're not going to remember that you said that the function of the heart is still the same as it's been for the last 3 visits. The parents will probably remember that, but I really think for the patient, it goes a long ways on focusing on these non-medical things, just normal life things.
Yeah.
Normalize that these are important things that we should be talking about. Ask about their mental health. Those are the things I would try to recommend for people that are up and coming.
That's great advice. Yeah. And part of the reason why you were doing that is because a doctor, a physician did that with you as well, right?
Yeah. And that's why I kind of went into the field.
Very inspiring, like story and how kind of you come up from that and like become such a great physician to all your patients. So I think it's really great to hear. Yeah. Also, like I guess like most reviewers are gonna be like pre-meds, and you kind of talked about your hardships like for med school. Is there certain like advice you would give for med school applications to these like pre-meds that are coming up?
Yeah, I mean, one thing when I was in pre-med and then med school and even in residency, I was always just so worried about all the small things that really don't matter. I think, it's so easy to get like obsessed with how much research you're doing, or if you have publications, or if you've done X, Y, or Z, and really stressing about that stuff. I think, yes, that stuff is important, but if I went back and looked at like where I was, 8, 9, whatever, 10 years ago and was in that position, I would probably tell myself to not stress about these little things, because ultimately things will work themselves out in most cases. I think I really focused and I was too hard on myself about trying to, check boxes. When you're interviewing with someone, and when I interview with someone now, I am much more interested on if they care about the things that they're talking about. If it seems like they joined this research lab and they just did it to check off a box and they don't seem interested in what they're talking about, and they're talking about their genetic testing in zebrafish, but they have zero interest in that, and they would rather be like doing clinical research, but they only did it for that reason, it's going to be obvious in an interview. And I think most people just want to meet with someone that's normal and can interact and have a conversation, and someone that is passionate about what they've done and what they want to do. So I think focus on things that make you happy, because these years will go by and you won't have them back. They can be very stressful, so try to do things that you're enjoying and not just things you're trying to check off a box to
for application. Yeah,
exactly.
And I feel like compassion is a big thing too. Like I feel like these interviewers want to see compassion in these future physicians. So I feel like that's one big thing.
These are also going to be your coworkers.
Yeah, exactly.
Like these are the people you're going to see in the office, and you walk by in the hallway, and they just want someone that's normal, can carry on a conversation, has interest outside of medicine. I think every interview I've ever had for residency, fellowship, and for a job, there's at least someone on that day that asked about like what I was interested in. And if you can't talk about your interests outside of medicine, that's not going to look normal.
Yeah,
and I don't think that they're going to want you there. So definitely have interests outside, because that's important for your own mental health too.
No, that was great advice, honestly. And you want to move on to the next?
A side question from this. I know you said everybody should have like interests outside of medicine. What are some of your interests?
Oh yeah, we can talk about that.
So I'm a big sports fan. I don't play many sports, but I love college sports. I'm a University of Arizona fan, so bear down. Even though we're not really great in anything except for basketball, I still love watching my college sports. I really enjoy golf. I used to golf more. I haven't been into it, but I'd like to get back into it now that I'm living in Houston and I can play golf probably year round. Yeah. And then I enjoy like being outdoors. So I have a big interest in national parks, and I've been across probably like 15 or 20 national parks off, and hopefully I can.
Yeah, outdoorsy. Yeah. Exactly. So we do have a signature question we're going to ask every guest from here. And before we ask you this, like, we plan on asking this for everyone. And I guess I'll let you take this one. Okay. Since
the signature question is: if you could go back and talk to your younger self, the one who was just starting this journey, what would you say to yourself?
I think, because you guys have given me these questions before, it's kind of what I just said.
Yeah.
Don't sweat the small things. Focus on big picture and just try to have a normal life outside of medicine. You need to care for yourself before you're able to care for other people and for your patients. So I would just really encourage people to not get so stressed and bogged down by these little things, and really just try to have a normal life outside of it all. Because, like I said, these years will fly by, and the medical journey is very, very long. You don't want to like look back and like regret all of that. Just if you got into one place versus another, and you're going to get to the same place in the end with your job, just enjoy it while you're doing it.
Well, perfect. Thank you so much, Dr. Glenn. This has been an amazing conversation. And your story basically defines like there are no setbacks that should stop you. Everybody has challenges. Everyone's going through a lot of things, but you shouldn't just give up, and stay consistent to your path. it will all work out. So, before
Honestly,
we
thank
let
you so
go-
much. And then, we'll do the outro. Like, and that's a wrap for the Dreamers. This is our first podcast episode. And again, we plan on having a lot more. We have a lot more set up. And I feel like we did set the bar pretty high with you. Because you're a great
This
speaker,
was a
honestly.
great
This is a great,
conversation,
great
yeah.
conversation. And please subscribe, share, and we're going to bring you guys more in the future.
And before we let you go, where can people follow up with your work or with what's going on for the future of the congenital heart diseases? How can people know what you're doing, or in general, like what work is going on?
Yeah, so first of all, if people are interested in pediatric cardiology and have questions, you can email me at my Baylor email. It's thomas.glenn with 2 N's at bcm.edu. I'd love to talk to anyone who has ideas or research interest or really just wants to hear about the field a little bit more. I think if you are entering the medical field or you're interested in pediatric cardiology, I would encourage people who are up and coming in the field to go to the Congenital Heart Academy. They have a bunch of lectures and a lot of good learning online on their website where you can really learn about the field, see what research is coming out, and really get a good sense of what the field includes. So.
Perfect. Thank you so much.
Thank you so much.
Yeah, so keep dreaming, keep pushing forward, and we'll see you next time.